Today we'll talk about BPD. What is BPD? BPD is Bronchopulmonary Dysplasia. It is also called as the chronic lung disease of prematurity. Now, what is it? It is either the persistence of the parenchymal lung disease or X-ray showing the parenchymal lung disease, right? In whom, as per National Institute of Health, the definition is if the baby is born in less than 32 weeks of gestation and in more than 32 weeks of gestation. For 32 weeks of gestation, those who received oxygen for first 28 days of life in any form, nasal prongs, CPAP or ventilatory support, they will assess the oxygen ki requirement at 36 weeks of post-menstrual age, right? And in any form, if the oxygen requirement is there, maybe in the form of CPAP, ventilatory support or nasal prongs at 36 weeks of post-menstrual age for more than 3 consecutive days to maintain the saturation of oxygen between 90 to 95%. Okay? That is the definition of your BPD. Now for more than 32 weeks, it is again those who have received the oxygen for the first 28 days of life, and in them we'll assess the requirement of oxygen at 56 days of post-menstrual age. And again, if they required oxygen in any form to maintain the saturation between 90 to 95%, they are labeled as BPD. Now, as per National Institute of Health, BPD has to be mild, moderate or severe. Okay? Mild is that if when there is no supplemental oxygen is requirement. Moderate is when the supplemental oxygen requirement is less than 30% by any means, and severe when it is 30% or more than that oxygen requirement is there, or CPAP requirement or ventilatory support requirement. Now, what is the physiological definition? Physiological definition is, under this we perform the room air challenge test. Okay? Room air challenge test is performed. What we do, those who are less than 32 weeks of gestation, we perform this test at 36 weeks of corrected post-menstrual age, and those who are born at or after 32 weeks of gestation, we perform this test at 56 days of life or at the time of discharge, like before discharge, right? And if the oxygen requirement is there and the saturation is less than 90% on room air, then we label that patient as BPD. The term BPD also includes the term infants. Okay? This term is also used for term infants who show oxygen dependency due to any underlying reason. Maybe due to mass, maybe due to pneumonia, maybe due to genito-intestinal problems or any other problems, when they show dependency of oxygen at 56 days of post-menstrual age and the oxygen requirement is there to maintain the saturation between 90 to 95%, they are also labeled as BPD. Now, who are at risk of BPD? Those who are born in less than 28 weeks of gestation and 1.5 kg weight, less than this, they have 30 to 50% chances of developing bronchopulmonary dysplasia. And the preterms who have received oxygen and those who are the candidates of BPD, they can also develop chronic respiratory morbidity. Chronic respiratory morbidity, and the incidence is almost 44%. Chronic respiratory morbidity means at 18 months of corrected gestational age, they may require any sort of the pulmonary medications for their respiratory support. So, preterm babies who have history of BPD at 18 months of just corrected menstrual age or corrected gestational age, they have 44% incidence of developing the chronic respiratory morbidity, that is there is requirement of any sort of the pulmonary medication. If we'll compare the preterms who don't have the incidence of BPD, right, in them the chances of developing chronic respiratory morbidity is 29%, right? It is 29%. So another definition of bronchopulmonary dysplasia, where we will grade the severity. In premature infants who are born in less than 32 weeks of gestation with BPD, who are having persistent parenchymal lung disease or X-ray showed confirmation of parenchymal disease, in them at 36 weeks of post-menstrual age, if any one of the following FiO2 ranges are present for 3 or more than 3 consecutive days to maintain the arterial oxygen saturation between 90 to 95%, right? There are grade 1, 2, 3 and 3A. And depending upon invasive, intermittent positive pressure ventilation is required, nasal CPAP, nasal cannula, or you have non-invasive positive pressure ventilation, right? So grade 1, in invasive, it is grade 2 when it is 21%, and grade 3 when it is more than 21%. On nasal CPAP, on non-invasive positive pressure ventilation and nasal cannula, if the flow of oxygen is more than 3 liters per minute, if it is 21%, then it is grade 1, 22 to 29% is grade 2, more than 30% is grade 3. If nasal cannula with flow of oxygen at 1 to 3 liter per minute or by hood, then grade 1 is between 22 to 29% and grade 2 is between more than 30%. And if nasal cannula with flow of less than 1 liter per minute, and grade 1 is 22 to 70 and grade 2 is more than 70. Now there is another category called third A, where if the death of the baby occurs between the 2 weeks of postnatal age to 36 weeks of corrector gestational age because of the persistent parenchymal lung disease or respiratory failure, and which can't be attributed to any other comorbid situations like neck, IVH or sepsis, then again it is labeled as third A stage of BPD. In next video, we'll talk about the pathogenesis of BPD.